Well, we're going to talk about the tax part today. And once we talk about today's topic is whether you're going to have to pay FICA forever, then I'll open the floor. This is a completely live Q&A topic parts. And so we're going to talk about the topic part first. It should be pretty quick today, probably about 10 minutes or so. And then I'll open it up for any questions you have out there. So make sure you type your question into chat and I'll get to as many as possible. All right, so FICA taxes. Everybody loves taxes, and everybody wanted a whole bunch of people wanted me to talk about this, and they were surprised, and so I figured I'd just go ahead and make a video rather than answering a whole bunch of individual questions. All right, so let's go ahead and get started. So we're looking at let me. This is live. It's always live. Um, all right. So we are talking about FICA taxes. So the FICA is Federal Insurance Contributions Act. It's been around since 1935. That's how Social Security is funded. Part of that goes into your Social Security. So 6.2% of that. So you pay 6.2%. And for those people out there that are self employed, you pay the other 6.2% because you are your own boss. And there's also the 1.45% that goes into Medicare. So FICA includes both Social Security and Medicare. So if you're just working for a company, you pay 7.65% and the company pays the other 7.65%. There's another Medicare tax that was added a few years ago. It's a 0.9% for high wage earners. So if you're a single making over $200,000, then you're paying another 0.9%. All right. So the question is, do you have to pay FICA taxes forever? And the answer, super long story short, yes, you do. Even after you reach 65 years old, even after you start receiving your retirement benefits, whether it's early retirement or full retirement age retirement or delayed retirement credits at 70 years old, it doesn't matter. You will pay FICA taxes till the end. There are some cities, counties that do not pay FICA. That's probably like 4 or 5% of the workforce that works. Firefighters in Chicago and teachers in LA, and there's some other places as well throughout the country that don't pay in. And Texas teachers don't pay into it. So yeah, they have opted out of the system. All federal employees, the ones that have been around for about 40 years, they're part of the old system that didn't pay into Social Security, but all the new employees essentially since pay into Social Security. Politicians pay into Social Security. That changed in the 1980s. So yes, you have to pay your FICA taxes forever, even after you start collecting your benefits, your monthly benefits, Medicare, whatever the survivor benefits, disability benefits, spouse benefits, retirement benefits, doesn't matter. You will always pay FICA taxes. And how does that benefit you? Well, just like anything else, your retirement benefit from Social Security is determined by your high 35 years of earnings. So, your high 35 years of earnings, if you're 80 years old and you're working, and last year was one of your high 35 years, you had a good year last year, then what happens is once you file your taxes, get your taxes done in April, you send it to the IRS. IRS looks at it, proves it, whatever. They send it to the Social Security Administration and says, hey, this person worked last year and they made X amount of money. Social Security looks at it and says, is this one of the high 35 years? And they index this for inflation, for a kind of a wage index. It's basically, so be careful of this. A lot of people mistake this and they think nothing's going to happen. Is when you were pumping gas when you were 20 years old and you made $20,000, and last year, let's say you made $100,000, you're like, oh yeah, last year was definitely one of my high years, so it'll kick out that low $20,000 year, and I should get an increase in my Social Security check. Not necessarily so, because that $20,000, back in 1975 might probably be worth more than $100,000 this year. So again, so it's indexed for inflation. So All right. So if your last year was definitively one of your high years, then again, Social Security looks at that, kicks out a low one, recalculates. And because they can't do that until you actually file your taxes and everything, it takes a little bit longer. The COLA increase, that happens immediately, first part of the year. The increase, because you paid more into FICA, that takes a little bit longer. So maybe April, May, June, July, or something. But you won't lose anything, because what they'll do is they say, well, this year your benefit should be another $10, $15, $20 because of the work. They will give you the back pay to January. So in June, July, or something, all of a sudden you might see an increase of $100, $150 or something like that. You're like, well, what happened? Well, they're giving you all the back pay to January, and then from there going forward, you'll get the extra, $5 or $10 a month, whatever the increase is based on that. So yeah, so the FICA tax, and if it doesn't increase it, the question people ask is, okay, well, if I work and it doesn't increase my benefit, what's the point? Since well, that's this part of the unfortunate, the social part of Social Security. I used to get that all the time when I used to work at the Social Security Administration. We took several you know claims a day, and in the morning, I would have someone talk about that and say, hey, where did what's the point of me paying? It doesn't benefit me. And then later on in the day, unfortunately, to have a family that just lost their parents in a sickness or a car accident, and that person was young, 27, 28 years old, but they left behind 2 or 3 kids. Those kids will receive benefits until they're 18 years old, or when they graduate high school, and kind of that's where those benefits go to. So it's that's part of the social part of Social Security. All right. So yes, you will pay FICA taxes forever, unfortunately. Um, and a lot of people try, they're self-employed and they try to set up an LLC and all this kind of stuff to avoid paying the FICA taxes. And yeah, I understand. But from my personal experience, taking hundreds of thousands of retirement claims and talking to people, 99.9% of people regret it, because they do that when they're young, in their 30s, 40s, and 50s, and they try to avoid FICA and everything like that, and then something happens, they get divorced, they lose their business, or whatever the case may be. They come file for retirement decades later and say, well, your check is going to be $600 a month for the rest of your life. They say, well, how am I supposed to live on that? I says, well, it's determined, your check amount is determined on how much you paid into FICA, and you avoided paying that for decades, and there you go. So yeah, so think about those early decisions when you're young, and make the right decision. It's completely up to you. All right, so let's see here. Let's get into some questions. Michael, how likely any other responsible fixed proposals for WEP will be adopted? Yeah, they've been talking about it's 99, well, 100% of the time, it's always some politician looking to get more votes. And they said, oh, if I get the federal employees in my district to vote for me, that'll really put me over and I'll be able to win the next election. How can I pander to those people? Oh, okay, I'll tell them I'll get rid of WEP. So they get some, legislation. Remember the old Schoolhouse Rock, how a bill becomes a law? They put their name on some bill that's going to end WEP, and there's been a bill that ends WEP since WEP began, decades ago. And sorry, y'all fall for it every time, and nothing happens, because again, take my WEP challenge. Watch my video I did on the WEP challenge. The problem with WEP, the windfall elimination provision, for those that don't understand, those are the 4 or 5% of people that didn't pay into Social Security. But basically, they want a welfare benefit that wasn't entitled to them. So watch my video on the WEP challenge. What is the earliest you can retire? All right, good question. But YouTubers and TikTokers and Google and stuff out there, it's they always give you the kind of an incomplete answer. That's why my videos are so long and detailed, is try to give you the complete answer. So when can you retire? If I'm going to do a video on this in about a week or so. Retirement is not retirement. But anyway, um, if you are talking about retirement and turning in terms of collecting Social Security benefits, if you are a surviving spouse, then you can start your retirement at 60 years old. If you're just going to file for your own benefits or as a spouse, your spouse is living, then 62 years old. The full retirement age, it's not 65, it's 66 and 6 months or 8 months or 10 months or 67 for your full retirement age. That's when your benefits will not be reduced once you're full retirement age. Jane, I retired at 48 due to a layoff and just turned 64. I plan on waiting till age 70 to collect Social Security. I was married for 10 years. If my ex-husband dies before I do, my benefit increases to his amount. Okay, so you're okay. So you're not receiving any benefits at all. So here is a strategy some people use is so you're waiting for benefits on your own record. So you're gonna let me put up my little you're going to be waiting for benefits on your own record until you're 70 years old. So, for instance, if your ex passes away and you were married to the person 10 years, so you're entitled to benefits, then what you should consider is filing for survivor benefits. Don't touch your own, restrict your application to just survivor benefits, even though it's less money or whatever, because you're not going to touch your own. You want yours to increase all the way till your full retirement age or 70 or whatever the case may be. So get survivor benefits, get that money coming in. And that way you got money coming in. And then once your benefit amount gets to the amount you like, then switch over onto your own. So you can, in your particular case, you could have your cake and eat it too. Uh, the person is currently living, so you can't do that now. So you have to file for benefits on your own record, and then you file for spouse benefits if that person is living, your current spouse or your previous spouse. That's a strategy you can only use for surviving spouse benefits, widow benefits, widower benefits, same exact thing. Is it true that wages aren't indexed after 60 years old? Linda has been doing some homework. Yes, exactly. Yeah. So basically, after 60 years old, you're getting close enough there and to your retirement age, and so they stop indexing at 60 years old. I'm on SSDI for 2 years. My tax accountant says I don't have to pay any taxes. I'm living in Kentucky. Okay. All right. I don't do taxes, so I would defer to that person. Dr. Weir, my Medicare savings program was supposed to begin on June 3rd, so the premium would be paid. But I was sent my Social Security check on a regular day with the premium removed this week. Who do I contact? Yeah, the Medicare savings program I talked about last week. It's the program that the Medicaid offices throughout the country, they can pay for your Part B premium. Cynthia signed up for that. Awesome, good deal. Save yourself $174.70. But I worked for the Social Security Administration for a few decades. Before that, I worked for the social services. I did Medicaid. And I can tell you the two computer systems do not talk. And you've also got Medicare in there as well. So you've got three computer systems that just don't want to talk to each other. So yeah, you just have to give it some time, a month or 2 months or something like that. And if what happens is the system will recognize that for the month of June, they take them for Medicare, they take that money out the previous month. So you pay for Medicare a month in advance. But if they see that there are two payments for the same month, payment from you and the payment from your state, then they'll reimburse you that. So yeah, you just have to wait for it, unfortunately, to kind of work itself through the system. I am planning to retire next June. A follow up here is if your birthday is mid-month June. Okay. If your birthday is mid-month and you plan to retire the same month, do you need to wait until then end of the month to get credit for the entire month? All right. So Social Security says you turned your age the day before. And if you're 62 years old, yeah, all this is kind of strange. But if you're 62 years old, you have to be 62 the entire month to start your benefits. So if you're 60, let's say you're 62 June 15th, you're not 62 until July. And so you can start your benefits in July. You just start it in July. Um, and your first check will come in August. Different than Medicare, Social Security benefits are always paid the following month. So for the previous month. And why do they do that? Because at the end of all of our lives, Social Security wants to be able to go in there and grab that last check. And you have to be alive the entire month. You have to make it to the entire month. So you have to, make it to June 1st in order to collect the benefit for the previous month. Um, so, and then, okay, make sure I answer this question. If your birthday is mid-month and you plan to retire the same month, you need to wait until the end. No, no. So again, you can wait. So if your birthday is in June, 1, 2, 3 months before June, you can go ahead and file for benefits and just tell them you want to start your benefits in June. Unless you're turning 62 in June, then, again, you have to wait. You have to be 62 the entire month. So you have to start your benefits in July. It's all so crazy. How far back in time will Social Security consider a do-over? Wow, I've never heard of a limit. I mean, there's been court cases and all kinds of things that we had. Well, the entire country had. Um, oh gosh, it's I forget the name of the acronym now, but they had a special unit that I guess somebody had found a miscalculation and yeah, so Social Security had to fix it, and they had to go back decades. The entire country had to go back. Yeah, so there was a special work unit for what 5 or 6 years that had to go back and correct all those things. So I personally have I've found a situation where this guy was homeless, but he was entitled to benefits for like 3 years because another office messed up, and so we got 3 years back pay for that person. And yeah, so I've never heard of a limit. If Social Security messed up or whatever the case may be, and they need to rectify the issue, then they will rectify the issue. Linda, is it true that beginning next month in June, the Social Security system will be rescheduling checks by splitting up payments throughout the month? Yeah, no, I haven't heard that. I'm going to do a video on all the internet myths out there. I'll probably do that next week or so. Should be a interesting one. Yeah, there's so much garbage out there, especially when the YouTubers and TikTokers and there's a lot and Chat GPT, all the AI out there. There's seen so many articles. They just you get some supposed newspaper or whatever they come up with, and they just plug in a bunch of stuff in the AI and generates thousands of articles. And if you've ever looked for something on Social Security or Medicare, then the Google shows you those articles, and there's just so much garbage out there. So much garbage. Yeah, one of the ones that's going on now is you get 2 checks this month, and so everybody, YouTubers and everybody, oh, you're getting 2 checks this month. Yeah, listen to me. Hey, click here, and you click it, and it's because next month, particularly for SSI, um, June 1st is on a weekend, so they're just going to pay a day earlier because it's on a weekend. They do that, all the time. But so you're not getting 13 checks a year, you're getting 12 checks. But you've now clicked and you've bought into the hype. Linda, can you use HSA money to pay your Part D, G, or I've heard, yeah, people, yeah, I've heard again, HSA. There's HSAs and there are HRAs, and but yeah, I've heard of people paying HSAs using that money to pay for the premiums. I would definitely check with your administrator there and confirm, but yeah, I think it's a good use. Uh, oh, okay, same question. Did I skip anybody when I was looking for the other part of his question? Let's see here. Oh, Cynthia. Oh, okay. No, okay. All right. What else we got here? MM. What's up, MM? Can you receive any of annuities, dividends, interest, capital gains from your Roth IRA while collecting concurrent SSI and SSDI? Oh, yeah. If you have any of those, then you really need to contact Social Security immediately, if not sooner, because you are receiving. If you're receiving SSI, that's a welfare-based program. You, yeah. If you have any of those, then yeah, Uncle Sam's going to come looking for you. Because I mean, if you have SSDI, if you only mean SSDI, Social Security Disability Insurance, no, it's not an issue whatsoever. But you included SSI in there, and SSI is a welfare-based program. And if you've got any annuities or interest or capital gains or Roth IRAs, then you shouldn't be receiving SSI. But I'm figuring you just typed in SSI because you thought that was part of the program. But yeah, that's the welfare-based program. Penelope, I understand that a disabled widow can apply for Social Security as early as 50, but who determines what is disability? Does she have to be SSDI, a doctor's certification? Yeah, Penelope, I'm going to do a video on that. What is considered disability? Yeah, Social Security does the same thing they do with everybody else in terms of disability. There's no kind of changes, for anybody filing for disability, whether it's on their own record or disabled widow benefits. Oh, that's another one I've got to do. Someone said that you can only get disability benefits on your own record. I saw YouTube about that recently, which is incorrect. You can get the disabled widow's benefits, which is on your deceased spouse's record. And yeah, so you can start it at 50 up until 60 years old, and you get 71.5% of the deceased spouse's PIA, which is the primary insurance amount. And yeah, you just go through the regular stuff and you file for disability, disabled widows benefits, DWIB as we used to call it, Social Security, or they still call it. And yeah, go through the whole procedure. They reach out to your doctors, medical doctors, get all the medical documentation. And I did a 4-part series on applying for DIBs and tips, tricks, and secrets a few weeks ago. So if you're looking to file for disability, make sure you watch those 4 videos before you actually file, and then file as soon as possible, because it takes 6 to 9 months if you're lucky to get it approved, because Social Security is at a 27-year low. Cynthia, thank you. You're welcome. Zippy, follow-up question: do I have to pay FICA taxes? Comedian out there. Linda, why can't drug companies? Oh, that's all right. Should I even read the rest of this question? Because they can and they own America. Okay. Why can't drug companies provide copay assistance to Medicare recipients like those on work private insurance? I currently pay my deductible on copay. Yeah. Yeah. There. I think I already answered it, because they own America and own politicians, and anytime the drug companies can get more out of the government, they do. So yeah, and a lot of people, this is an unfortunate part. Drug companies, for like their very, very expensive drugs, they give you discounts if you're like on private insurance and stuff like that. Some type of program, where we'll give you this and yada yada yada. But as soon as you go on Medicare, you read the super fine print, and maybe this is what you're talking about. Yeah, then they say, yeah, and once you're on Medicare, you don't get any of those discounts, because we're going to charge the government. I'm not sure why they they some backroom deal with the private insurance companies and saying, okay, hey, we'll help you give your your members this drug for a super discount. And then once I go on Medicare, yeah, I'm not sure how the drug insurance companies make that money, but they do. If surviving spouse never worked, can she file for reduced spousal benefits at 62, then switch to 100% survivor benefits at FRA? Oh, I'm not sure what are we talking about here. Okay, so a surviving spouse never worked, so she can't file for benefits on her own record. Reduce spousal benefits at 62. Okay, all right. So maybe you mean you file for spouse benefits. Yep, that's fine. you're not insured on your own record, so you go ahead and file for spouse benefits at 62 if your spouse is currently receiving benefits, or if your ex-spouse is at least 62 years old. And let me take this opportunity to, regular viewers, beat this into the ground. Another myth: your previous spouse does not have to be receiving Social Security benefits for you to file. If you were married to that person for 10 years or longer, it doesn't matter if they're going to wait until their full retirement age or 70 or never collect Social Security benefits just to spite you. Doesn't matter. As long as your previous spouse is 62 years old, you can file for spouse benefits on their record. It's called independently entitled divorced spouse. There are millions out there I know that are not getting benefits. So please, we're trying to, my job is to make sure you all get your money. So yes, so you can file for spouse benefits. And then what I think is when that person passes away, you'll get 100%. Yeah, if and it'll be automatic. If we're talking about the same ex-spouse here. If you're on that spouse's record at 62, and then they pass away when you are your full retirement age, then you'll receive. So survivor benefits are crazy complicated. You'll receive, if the person never started receiving benefits, then you'll receive 100. They're basically they're 100% of their PIA, their full benefit amount. If they're already receiving benefits, you receive 100%. Again, your full retirement age. You'll receive 100% of what they were actually receiving. And then there's an exception if they actually filed early at 62 years old. It's called the widow's limb. So survivor benefits are very, very complicated. Oh my God, I have a Roth IRA. Yeah, so you definitely, if you're receiving SSI, and people say, well, how do I know if I'm receiving SSI? If your Social Security check is, over $943, over that, if your Social Security check is, $1,000 or more, then you're not receiving SSI. So because SSI, the most you can get is $943. So what happens is you can get both. A lot of people receive both. They worked, but it didn't work that much, and then they filed for retirement benefits, and the retirement benefits are only $500. So if they're low income and resources, and they apply and are approved for SSI, then they can get another $443 from SSI. So the SSDI or retirement, and then above and beyond that, some SSI. But it is, resources for a single person with the resources this year is what, $2,000. So anything over that, you wouldn't qualify for SSI. So Ark, hi from Texas. Hey, Texas. Went to high school in Paris, Texas. I began Social Security at 62. My last annual statement was dated February 2021, showing estimates. I called the office to get my actual PIA amount, was given my current benefit amount. Oh, was given my current benefit amount. All right. So the estimates on mysocialsecurity.gov. Number one, great. Please, everybody out there, make sure you set up a My Social Security account. Go in there and check your earnings. Make sure your earnings are correct. If you've got children or grandchildren or cousins or aunts or whoever, tell everybody to set up a My Social Security account and go in there and make sure your earnings are correct, because that's how they determine how much you will receive for the rest of your life from Social Security. And if you set up an account, it makes it more difficult for other people to hack your account and cause trouble for you. So please set up an account. But in terms of the estimates online, they are estimates. Yeah, you never get your definitive number until you actually file a claim, because there's so many variables. And everybody that watches my channel knows there's exceptions to exceptions, particularly with survivor benefits. Survivor benefits is a nightmare to figure out in some instances. So yes, the estimates, particularly the example I like to give is if you go in there at 55 years old and you look at your benefit amount and it says, $2,500, and then you stop working. As soon as you check your benefit amount, you stop working for the next, 12 years. And because what Social Security system does is they say, okay, we're trying to project, several years in the future. and we figure you're going to continue working about the same amount you did last year and the year before. So they kind of extrapolate that and they kind of project it forward. So they figure you're going to continue working for the next 5, 6, 7, 10 years or whatever, basically about what you're doing now. And that's where they come up with the estimates. So if you immediately stop working after you check your estimate, then your estimate is going to be 100% wrong. And there's, again, the only way you can get a definitive number, 100% definitive number, is to actually file a claim. And as I always say, just because you're filing a claim doesn't mean you need to start the benefits. You can, go in and schedule an appointment and have them give your definitive numbers, go through the process. And if you want to start your benefits, then you start your benefits. But if not, you say, oh, okay, all right, well, that's food for thought. I'll wait a year or 2 years or 3 years. And there's some companies out there that actually charge you, that to come up with the estimates. And yeah, their estimates are always wrong because they don't have your, definitive work history. And yeah, that's so, why pay some company, they charge like $300-400 to give you an estimate of your Social Security and break even points and all that kind of stuff. And I think it's just all useless, in my personal opinion. Oh, all right. I already asked that one there. If you're currently covered through VA medical benefits, are you required to sign up for Medicare? Um, TRICARE, if you have TRICARE, yes. And I think I've got the policy. Let me pop it up on the screen here for YouTubers. Sorry, TikTok, please come over to YouTube. And I need 10,000 subscribers for TikTok to show everything. And so I don't have it there. So unfortunately, I'm not treating you all right. Come over to YouTube. So if you have TRICARE, you generally must sign up for Part A and Part B when you're first eligible to keep TRICARE. And, they put this in bold. If you're active duty, family active duty, you don't have to. But yeah, if you're receiving TRICARE, yes, you do. If you're receiving VA benefits, that means, you're like me, I'm an old Marine Corps sergeant, but I was only in 8 years, which is 20 years in the Air Force and, whatever. But anyway, so I'm not eligible for TRICARE, but I could be eligible for VA benefits, Veteran Administration benefits. But I don't get it. So for those, that is a completely individual decision. A lot of veterans get Medicare Part A, Part B, and as a fallback position, even though they're relatively happy with the VA, but relatively happy with the VA now is different than happy with the VA 5 years, 10 years from now. And if you delay sign up for Part B, there's a penalty for the rest of your life. So what some people do, an option is, let me put up my little thing here, is they go ahead and sign up for Part A, which is free premium. And the Part B is the $174.70. And then they get what's called a Medicare Advantage plan. And there's Medicare Advantage plan. Usually I recommend Medicare supplement plans, but in this particular case, a Medicare Advantage, because you've already got the VA, why pay, so Medicare Advantage plan, there's specific plans that the government allows companies to offer. They're called like Patriot plans and honor plans because they're directed to vets. And it basically, a lot of those pay for your Part B premium. So it's zero premium, and they pay for part of your Part B premium, part or all of it, depending on your area. So you get all these extra benefits, whatever extra benefits are available in your area: dental, vision, hearing, gym membership, and you can also go see doctors outside the VA in case you ever have need a second opinion in the future. So it's individual decision. Some people, a lot, sign up for those. And then they sign up for the Medicare Advantage so they don't have to pay the $174.70 a month, all of it or none of it. So there is that. And I just put my information. So if you know anybody that you know and trust that can help you with the Medicare insurance, plans, reach out to them. If not, I have put together a team of brokers throughout that can work in all 50 states and help you out, and 100% free and no obligation. They'll give you your options, and if you like it, do it. If you don't, tell them have a good day. Bye-bye. Cheryl, FYI, called local office in Ohio, only held for 15 minutes. Wow, awesome, awesome. Yeah, it's again, I ran the third busiest Social Security office in the country, and it was a whack-a-mole situation. It's the three whack-a-moles are you have to bring people into the lobby, you have to service them quicker in the lobby, you have to answer the phones quicker, and you have to adjudicate people's claims quicker. And you can't do all three with the staffing and the old computer system. So it was, something would happen. They say, okay, you really need to get your phones. Okay, well, the line's going to have to be longer, and we're going to take longer to adjudicate people's, complete people's claims and give benefits to them. But yeah, we'll answer the phones. And then the next month, it's okay. You got to get people in and service them quicker in the lobby. Okay, all right. So we'll take people off the phones and put them. So yeah, yeah. So I guess the office in Ohio is doing but I bet you they've whacked the other part of the mole. So yeah, good time. Hey, thank you. Welcome. Holy cow, maybe that's why my active SSDI is at 0 and my SSI is at 900. Yeah, if you've got some other money there, yeah, you definitely need to reach out to them and get that straightened out, because Social Security, yes, it takes forever, but when you file for SSI benefits, part of that is you are authorizing Social Security to check those financial records on a regular basis. So it hasn't popped up yet. But they use LexisNexis and different programs, private programs, to check all that. It will pop up, and your local Social Security office will get an alert. We call it a diary, um, and it'll say, "Hey, this person get SSI, and we found some money. Give that person a call." But it might take a month, or 2 months, or 3 months, or 4 months, or 6 months, or a year, and all that time you're being overpaid. And yeah, so uh, am I not asking the question correctly to get that amount I seek? Arc, is that a part of another question? Arc. Oh, okay, yeah. Okay, he was from Texas. My last annual statement was dated. I've called local office to get my actual PIA amount was given my current benefit amount. Oh, okay. Oh, okay. Oh, okay. I see your question. Yes. So, so you were given, yeah. So the person at the front window or the person that picked up the phone just, you know, Social Security is hiring new employees, and it takes 2 years to teach new employees how to do their job. So yeah, just call them up and ask for your PIA, your benefit amount at your full retirement age, and yeah, they should be able to give it in 2 seconds. And if someone is not be able, if someone can't give it to you in 2 seconds, then yeah, they were just hired off the street yesterday, and they shouldn't be put on the phones. And again, maybe that office, is being harassed by their bosses. You got to answer the phones quickly. Hey, we got no staff, so we just hired this person yesterday. All right, put that person on the phone, and we want. So yeah, that's why I'm doing all these videos to help you all get all this. 89 people watching. Let's hit that thumbs up button. Happy Saturday, Ed. Yeah, you're welcome. Thank you. Everybody's always looking out for us. And happy Saturday. They told me no. Yeah, let's see. Why are Medicare Advantage plans so much more generous with the breadth of benefits dual eligible people? Because it's with Medicare, the sicker you are, the more the government pays those plans. So all those Medicare Advantage plans, the zero premiums and stuff, you're like, wow, this company is so awesome. They're they're giving me all these benefits, and let me see the doctor I like, and there's zero premium, and they're giving me dental and gym membership, and free ice cream and unicorns. I did a video on this. Um, and wow, they're so awesome. And as I've said several times, not so much, because all that money you paid into FICA, that Medicare for decades, that's in Washington. And then when you sign up for a Medicare Advantage plan, that that company goes to Washington and says, "Hey, give us this person's money." And if that person is sick, not well, then they get more money. So it's more beneficial for them to hire to get sicker people, and because they make more money. And with, there's also, when you have a dual plan, you have Medicaid, you have Medicare, then you have, a Medicare Advantage dual eligible plan, and then you have the what's called the extra help with the prescription drugs from Social Security. So you've got like 4 or 5 or 6 programs there, helping you pay for your health care. And insurance companies know how to play the games. So yeah, so there's a lot of money in it for them, and therefore they do everything they possibly can to entice you to join their particular program instead of their competitions. So yeah, and so it is what it is. I wish it wasn't that system, but that's the reality, and so use it to your advantage while it's here. Every year, well, with people with dual eligible, they can change their plan several times a year actually. Um, So if you're on Medicare and Medicaid and have a dual eligible plan, you can change your plan several times a year. This year is 4 times a year. I think they're going to change it next year. And yeah, so you can change your plan and use that against the your companies. Say, okay, well, you're only offering me $1,000, and I need some dental work, and this other company is offering me $3,000. So I'll go ahead and get this $3,000, get my dental work, and then maybe later I'll come back to you because you got my doctor. But right now I just need dental work, and so I'll do that. And I'll sacrifice my doctor for the dental work, and I'll come back later to you because you got my doctor, and I'll have So yeah, work it. Let's see. White Silver, I am new to your channel and glad I found you. Just put in a few questions and bumped me off. Said too long. Okay. So may or how do I set up yeah, I do 99% of my 99.9% of my help is 100% free. But yeah, to pay for all that free content and everything, I do offer very limited amount of private consultations. But yeah, I charge for those. So yeah, I hate charging for stuff, but um, have to pay the bills. My wife said, stop using retirement money. All right. So, yeah, on the top of the very chat, I've got my link on there, my calendar link. Just go in there and schedule a time. And pretty much on all my videos in the description, you can find the link there as well. Uh, Will I see every code a doctor uses to get paid? I want to be sure I'm not being coded for a health issue I don't have, so they get paid more, and I won't be accepted to another insurer. Wow. Yes. Yeah. You can request a detailed accounting of all that stuff. Yeah. I did a video yesterday on Medicare supplements, and I think I was a little bit too brief with the plan and diagnostic and the copays and everything. So this morning, I went in there and I added CMS's policy on diagnostic and the $20 copay, up to $20 copay. So someone said, "Hey, you need to be a little more specific on that." And I looked, "Yep, you're 100% right." So I corrected that today. So, yeah, and in terms of your the reason I say that is because I included all the codes in there. So yeah, you can just request a coding. If everybody did that, it's a pain in the butt to do all that, but I mean, it would save Medicare probably billions of dollars from all the fraud and stuff. I listen to you as much as I can. Initially, it was confusing, but the more I listened, the more I understood. Your service is valuable, and I'm grateful. Oh, yeah, I appreciate it. Yeah, unfortunately, sometimes take like survivor benefits and working while disabled. Those are probably two of the most difficult topics, and it just you get down a rabbit hole, and there's an exception, the exception, exception. So yeah, I'm glad it's clicking. My explanations are always too long and convoluted because the whole policy is too long and convoluted. So please hit the like button. Yes, please. Thank you. Jim, what's up, Jim? If I claim at 62 and work until 70 and replace 8 0 years between 62 and 70, how can I find out will make a big difference in what I will be getting at 70? Yeah, you can actually go into the ssa.gov there, and you can do a manual input your manual earnings going forward. Um, and yeah, it'll tell you, obviously, won't be 100% perfect because don't know what the COLA is for future years and all the rest of that stuff. And so, yeah, you can definitely go in there and just do it manually. Sharon, I'm 49. Ex-husband, is 64, receiving retirement now. Married 12 years. Can I file at 49 years old? No. I think you put in a YouTube comment I saw pop up. Same question, and I haven't gotten to it yet. So thank you for asking again. No, unless well, let's see. Okay, so he's not deceased. So yeah, no, you have to wait till you're 62 years old because he's still out there alive and kicking. So you have to wait till you're 62 years old to start receiving benefits. Jim, everybody press the like button. Yes, please. Thank you. Kathleen, thank you. I will open a claim to see the real number. Perfect. Perfect. John, FYI, earlier question about HSA. Medicare supplement premiums are not eligible for HSA expenses. Only Medicare Part B and D premiums are HSA eligible expenses. All right. Well, awesome. Thank you. Our healthcare is so complicated. Yes. TIZ Ed, California also kicks in supplemental security payments along with SSI, which I'm told could be a few $100s more. Yeah, I think it was 250 or so a few years ago. And yeah, I live in a bordering state from California. A lot of people, California is expensive and they move to my state, and then they don't tell California about the move because they want lower cost of living, but they want to keep that extra few $100s. And yeah, so people are tricky. Linda, does SSA have a calculator to show how much your benefit would be if you stop working at 62, but don't file until 67? I guess what I see on my annual statement for 67 assumes work until then. Yes, you can just do like, was it Jim? I think it was. Yeah, just do it manually. Just go into the system, get your print off what you have from your earnings record up until that time, and then input that in the little spreadsheet on ssa.gov, the calculator, input all those years, put in your date of birth, and then going forward, just put the zeros or whatever the case may be, and it'll give you a very good number. Cynthia, hit the like button, please. Helps the channel. Yes, the more people get this information. Cadillac Jack, hey, we missed you for the last several days. Thank you for much of your knowledge. Yeah. How you been, Cadillac? Linda, is there a formula I can apply for starting with my age 62 benefit and adding X percent per year for waiting until FRA? Yeah, there is. Again, I would just go in there to the calculator and do it that way, and it'll figure the exact numbers up for you. It's every month you wait. So there's some of the common misunderstandings is that people think they can't start their benefits until their birthday, or another one is their benefit amount, waiting, they have to wait an entire year. And yeah, neither of those are the case. You can file any month, doesn't have to be your birthday, and every month you delay retiring, your benefit goes up every single month, all the way until 70 years old, right? Thank you. I'll visit my local office on Tuesday after the holiday. Ooh, I would probably avoid that. This was my office every single day, the line all the way out there. But we got that line in within 15 minutes because I had me and my entire management team out in the lobby expediting the line. And we were hated throughout the country because all the other managers in the country hated to go to the lobby and actually talk to the public. And I started doing it. And so other managers were guilted into doing it too. And they didn't like me very much. But I had good customer service. So Jerry Garcia, I'll begin Medicare Part A and B November 2024, but will wait to collect Social Security benefits until FRA. How will I pay my Medicare bill, credit card? Yeah, there's several ways you can do it. They can, there's Medicare, like a quick pay, what do they call it? Yeah, just a internet pay. Um, or you can just do it old fashioned way where they'll bill you every 3 months and you just write a check. Yep. And then once your Social Security benefits start, um, just be aware you might pay for the same month for a month or two, because it takes, they'll take out the check from your Social Security check and you've already paid it. So again, just wait for the system to recognize two payments were made for the same month, and then they'll return one of your Part B premiums back to you. So you won't pay 2 months. It just takes a little bit for the system to catch up. Ark, you are the best. Always. Thank you for your time. You're welcome. Overjoyed. Hey, overjoyed. I feel like I would have been better off in old age, and I learned to game the system and never worked a day in my life. It's unfair. Yeah, it's. Um, uh, Thank you for the info. God bless and Semper Fi. Yeah, Semper Fi. Hoorah. Freedom will ring. I have to say thank you for the free information that you make available on YouTube. It came in handy for me and my wife. Awesome. Good deal. Yeah, we got to figure out a way to gauge this, like an old Jerry Lewis telethon type thing, where you get the red, the thing going up there. How many millions of dollars? And I know we found millions of dollars already this year for people out there that, oh, I didn't know that. I'm going to head down to the Social Security office, and then they come back to the YouTube comment and says, yeah, I'm getting a new check for $1,000 a month. I'm getting a check for $200 a month. I've got this. And I got back pay, and so yeah. And this is, again, as I always say, it's not me. It's not me. I'm just some idiot here in front of a camera giving you a few decades of experience. It's y'all pushing the button and sharing and subscribing and all that kind of stuff. You're the ones that are getting this information out to people. So I appreciate you. I've been deemed permanently disabled through Social Security, but I'm only on Social Security 1340 a month. Since I'm on just SSI, Social Security, I noticed all my doctors are coding my illnesses. I think the initial they're using it HCI coding. Okay. Yeah, yeah, it's a good idea to keep up on that stuff. And if you're on Social Security disability insurance, yeah, I mean, that's good information you have. Um, when a CDR comes up, the continuing disability review. So, as I always say, watch my videos on CDRs. And number one, don't stress CDRs. Please don't stress. Social Security does a terrible job stressing people out, or they do an excellent job stressing people out, actually, when they shouldn't. So watch my video on continuing disability review, and yeah, do what you're doing now is, make a little journal and stuff like that. You did this, and whatever the question. And that way, when the CDR comes up, you've got all your ammunition right there, and it'll go through like a breeze. Linda, I'm running out of questions. All right, unicorns. When you turn 65, are you getting a supplement plan? I actually have federal employees health benefits, so because I'm a retired federal employee. So, but yes, uh, if if I wasn't 100%, I would get Plan N all day long, unless when I turned 65, if I was sick at that time, because I'm only 59, only 59. Don't look it though. Um, but yeah, if I was getting more sick and I'd have to go to the doctor more often, then I would get a Plan G. But if I was relatively healthy, then I would get a Plan N. Let's see. John, clarification of an earlier question. Surviving spouse is 50 years old, homemaker. Can she first collect reduced spousal benefits at 62? Yes. And then upon reaching her FRA, switch to 100% surviving spouse benefit. Okay. Yeah. So again, it's so surviving spouse is 50 years old. So collect the reduced spousal benefit. So yeah, so the reduced spousal benefit, unless it has to be on another person, because it's not a reduced. Well, it is a reduced spousal benefit. Yeah. So are we talking about two deceased spouses? Because yeah, you can't. No, that it doesn't. Sorry, it doesn't make sense that she files a spouse claim, which is, yeah, that unfortunately is written. That doesn't make sense. But no. So basically, to that. If If you start collecting benefits from a deceased spouse, then you're collecting benefits from that deceased spouse. You can't recollect benefits from the same deceased spouse. So maybe that answers it. Again, if we're talking two different people, then yes. Two different deceased spouses, then yes. Does the system automatically show $0 for the years you worked over 35 years? I appear to have missing years from 40 years ago, or my accountant really screwed up. Your accountant really screwed up. Because, yeah, no, it'll show everything 35, 40 years, 50 years, 60 years, whatever the case may be. It'll show everything. So, yeah, somewhere along the line, your accountant didn't put it in there correctly. I'm claiming 62, claiming my retirement. Can I file also for a common law relationship that lasted 15 years? Yeah, it really depends on the particular state. So you are going to start benefits on your own record at 62, which you got to do if the previous person is still alive and kicking. And if your state where you were residing at the time is a common law state, then Social Security has to recognize that. So yeah, if it's a common law state and the state recognizes your time together as a marriage, then Social Security has to as well. I was just there a week ago in Henderson. Yeah. Is it true that Massachusetts don't offer Plan N or G? Yes, they have kind of Plan NG lookalikes. Massachusetts is, yeah. I took forever to figure out trying to find one that looked like a Massachusetts one. And yeah, there's ones that look similar, that act similar to Plan N and G. But yeah, you can get one, but they're completely different names, and you have to add this, and then you add another thing to it to make it look like an N or a G. So yeah, again, insurance is regulated by states. And here's another kind of thing to watch out for is Social Security offers that awesome $255 lump sum death benefit for burial insurance. $255, yeah, whatever. And burial will cost $10,000, $15,000 or whatever. And so there's a lot of burial insurance agents out there, insurance agents trying to sell you burial insurance, and how they do it is state um, kind of state regulated burial insurance in your area. Call now. And you're like, oh, this is a state type of program for burial help and stuff like that. So you call, and it's basically, yeah, it's no different than any other insurance because, you know, because auto insurance in your state is regulated by the state. So here is it's a state regulated auto insurance, and free auto. No, it's just, yeah. So they kind of word it strangely in order to kind of get you to call. So that's another reason. And again, I've seen so many people that over my decades that have walked into the office and for survivor benefits and saw that $255 and said, hey, I just spent $10,000 of my retirement money. So that's why I do recommend, if you don't have a nice little nest egg for that end, then I would definitely get some type of life insurance, burial insurance. And that's another reason I added not only my Medicare network, I've also added a team of life insurance, burial insurance agents that can help you out, give you some quotes on that. So if you want that, just reach out. All right. I can't believe they have a separate dedicated department to handle phones at Social Security. Yeah, they're called TSCs, teleservice centers, and they're all out the country. And yeah, there's hundreds of people there. Yeah, I mean the phones, and then each office has to answer their own phones as well too. So I usually had and I literally I'd have 4 screens in my office. I'd have 2 that I was doing working, and then I would have another screen to show you what the lobby was. If the lobby was starting to back up, I get my management team and we go out the lobby and we expedite the line. And then I would have another screen showing the phones, and if the phones were turning red or yellow and too many people were waiting, I'd have people get on the phones and bring that down. And so yeah, it's like being in a baseball game all day. It's just moving people around trying to whack the mole. You said wages aren't indexed after 60 years old. What does that mean? What is index? Yeah, good question. So index is basically, um, as I mentioned, when say for instance you worked, cutting grass or pumping gas at 20 years old in 1975. Social Security doesn't say, okay, that $20,000 you made in 1975 is $20,000 today. No, so they index it and they set it to today's kind of amount. So that $20,000, might be worth $100,000 today. So that's the indexing. And they only do that up until 60. They only apply indexing to your wages up until you turn 60 years old. Why was my first Medicare bill 4 months? Yeah, hmm, 4 months. Yeah, well, they definitely. Okay, yeah, they bill you if you're not receiving Social Security benefits. They bill you on a quarterly basis. So you might have had a quarterly basis plus a month that you. So maybe they added the 1 month you filed plus 3 months, so they probably 4 months together. So TJ, great work, appreciate it. Oh, okay, yeah, I'm not medical coding. Let's see. How many years did you live in Las Vegas? I lived there from 1970s to 2009. 24 years. Strange because I don't gamble. Maybe $20 a year. I'm famously one beer Weir, so I don't drink or smoke, and so I'm not sure what the heck. Anyway, so it's actually the best place to be if you don't drink or smoke or gamble. Vet, honorable discharge, 8 years of service. Thank you for service. One of my doctors tried to charge Medicare $25. Okay. Let's see. Does Social Security take your VA compensation into account? Um, no, except for SSI. If you're receiving SSI, the welfare-based program, yeah, any type of income coming in, they take into account. But in terms of retirement benefits, Social Security disability insurance, survivor benefits, all that kind of stuff, no, they do not take that into account. All right, we are coming up on our hour. I'm going to do, let's see, a couple more questions. Do we know how often Plan B increases? Does it go up each year? Yes, it goes up. Well, not every single year. There's been 1 or 2 years when it actually went down. So yeah, we will find out what COLA will be towards the end of the year. Or excuse me, the Part B premium. Oh, we'll find out pretty much at the same time. You'll find out what COLA is and also what the Part B premium and what the annual earnings limit and all that. They come out, all of it at the same time. So, all right. So this might be the ribbon on this question here. Me again. So, are you saying if someone is a surviving spouse, only one marriage, they technically can't file for spousal benefits? So, a surviving spouse is spousal benefits. They're the same exact thing. So a surviving spouse of what type of, so there's spousal benefits, there's living spouse benefits and surviving spouse benefits. So you can't file if someone is deceased, you can't file for living spouse benefits because they're deceased. So you have to file for surviving spouse benefits, whether it's 60 or 62. They technically can't file for spousal benefits. So for surviving spousal can either file for her own record or again. So okay, so that's where the confusion is yeah, spousal benefits are surviving spouse benefits. So you were a spouse. Okay. Where's your spouse? Are they living or deceased? If they're living, you get up to 50%. If they're deceased, you get up to 100%. So yeah, so okay, I understand now. Now I get what the confusion is. Yeah, so surviving spouse benefits is spousal benefits. There we go. All right. All right. All right, let me do this last one. Jerry, I don't think Jerry's asked a question before. I'm 66. I applied for Medicare on 5/24 to start August during my special enrollment period. Good on you. When can I expect to hear from them that my application has been processed? Yeah, it's pretty pretty simple. Just a regular. So you might have already been receiving your monthly benefits and all that kind of stuff. And so, yeah, it'll be quick, probably within a week or 2 weeks. And then they'll notify Medicare, and Medicare will send you your, Part A, Part B card and everything. But now's the time to start figuring out, what you want in terms of covering all of the gaps, Medicare Advantage or Medicare Supplement. And I've got a bunch of videos on that. And if you need help, if you don't have a agent or broker that works for you that can give you all your options, give me a call, email me, and I'll find someone in your neck of the woods to help you out. All right, that'll be it for today. Y'all have an awesome night, and we'll talk to you next time.